Hello there, my name's Cheryl Lythgoe and I work for Benenden Healthcare Society. I have a background in general practice and I'm a nurse consultant who's also undertaking a PhD at the moment. Benenden have completed a series of workshops around how to support our members and the wider community on staying healthy during the current pandemic. This is the second session for businesses and we're looking at how we can support our employees and our employers in returning to the office. Our business requirement may be that we need to return to the office to make it a sustainable and productive output. But how do we do that safely? And we need to look at some of the pillars that underpin that safe repopulation. One of the overriding pillars is being guided by the available guidelines. These are generated by the medical, scientific and economic committees who advise the government on courses of action. At the moment, the guidelines are very variable and they are very fluid, they're continually evolving. If we have a look at the guideline around travelling to and from work, they're actually suggesting at the moment that we avoid public transport wherever possible. If that isn't available and possible for your employees, make sure that we do things like staggering work start times, we stagger shift patterns and we stagger lunch breaks, etc. so that can ease some of that burden upon transport. Provide your employers with face coverings or advise them on where to obtain face coverings from. A face covering will provide protection for other people if that employee is not showing symptoms of coronavirus. Make sure that you consider your mental well-being of your colleagues, and that means if they are mentally struggling at home, even if they are working well there, it may be a consideration for bringing them back into the office. From a physical health point of view, have a look at the layout of your office. It's preferable for colleagues to work side by side and not face to face. It's preferable at the moment, the guidelines are saying 1 metre distance, but we know medically that 2 metres gives us better safety and less risk. Think about having hand sanitizer stations, plenty of cleaning equipment. Consider if your employee is using a phone an awful lot of the time, are they cleaning that phone regularly? Is it staying with one person? Is there lots of different people using it? We would definitely need to consider the hygiene of the phone, the workstation, etc. for multi-use. Think about staggering your lunch and your break times. Consider those that need to pop out to other suppliers during the day, whether it be shops for lunch or whether it be meeting somebody else within the business for a different reason. And how can you protect that cohort from cross-contamination? Is there measures that you need to put in place there? There's also the practical issues of the pressures that the employee may be under. Their mental well-being we've already alluded to. There may also be some financial pressures that's compounding their mental well-being at the moment. Make sure that you really increase your communication channels. Most stress and anxiety is around the what ifs and the unknowns. So by managing that through excellent communication channels can help to decrease that stress. Maybe a video of what the new working environment will look like will orientate people a little better. If people are continuing to work from home, consider their physical health. Are their workstations appropriate? Are they taking enough breaks? Are they being supported by their local communities? Lots there to think about, isn't there? Please do get in contact or give us any queries if you have any feedback on that. But I do thank you for listening today. Stay safe.